and welcome to Health Live at Seniors Today. Those of you who were looking at this montage that preceded this my talking would have seen the face that you're seeing on the screen just now, because she has been here on our Health Live session in the past. I welcome Dr. Radhika Banka from Hinduja Hospital in Mumbai to this session. Before I invite her to speak on a topic that is very important and very relevant to, especially for those of us over here who are from the big cities, who are from the big bad cities, I might say. The topic is dirty air, deadly diseases, how pollution fuels COPD and lung cancer. We'll know more about what COPD and lung cancer is and how pollution can cause it from Dr. Banka. But before that, let me introduce her. Dr. Radhika Banka is a consultant in pulmonology at the Hinduja Hospital in Mumbai, which is in Khar as well as in Mahim. After her MBBS and DNB in respiratory medicine, she did an MRCP in the UK and a fellow in pleural medicine at the Oxford Pleural Unit in the UK. She completed her residency at training at the Hinduja Hospital, and she moved to the UK, where she worked at the Norfolk and Warwick University hospitals, followed by the Oxford University hospitals. And then she relocated to India. During her stint in the UK, she gained immense experience in multidisciplinary management of common respiratory illnesses, including asthma, COPD, ILD, pneumonia, lung cancer, and tuberculosis. She has super specialized in the field of respiratory intervention and pleural diseases. She has gained skills in thoracic ultrasound and being certified with Level 2 Royal College of Radiology thoracic ultrasound competence. Dr. Banka has around 16 international and 4 national publications to her credit. She was in the front line of the COVID epidemic in the UK, as well as later on in India. She has several achievements to her credit. I could just go on and on. Her profile is rather long, but we're really proud and privileged to have Dr. Banka here to talk about a topic as critical as what we have, which is dirty air and deadly diseases, and how pollution can cause all the havoc in all of us. But I must start off on a lighter note, Dr. Banka. You trained in UK, but now in India the air there is so much cleaner than what it is here, right?
Yeah, absolutely. There is and then of course we've got science and data to show that the air is cleaner there.
Yeah, and so it must be a dramatic shift in and change for you in terms of what you, well, the learning is the same, but what you actually have to apply is so dramatically different.
Yeah, absolutely. It is very different.
But before you continue, do you see the pollution levels, having really increased, so much? For instance, you are in Mumbai, where there's construction everywhere. If there's no road construction, there's some redevelopment. There are new buildings coming up, and it's really horrible. So you obviously find pollution levels having gone up considerably, and as that led to a lot of people coming to doctors like yourself?
Absolutely. At the outset, I would like to thank seniors today and Mr. Pradyuman for the opportunity to be here with all of you. It's always a pleasure being with you. So I've done this earlier and I had a great time. So thank you for having me. So as Mr. Pradyuman said, very important discussion today about pollution. And this is something which primarily affects like each one of us, even if we do not have respiratory symptoms, but we are dealing with the pollution on a day-to-day basis. So coming to your question, Mr. Pradyuman, yes, definitely, there has been an increase in the pollution levels in all the metro cities in India. And this is just not anecdotal. So there is data to show that the AQI, which is the air quality index, has been progressively worsening. And I've also got some data to back this up. So, for the consecutive 14th uh, 14th year, so Delhi and Varanasi both have been amongst the topmost 20 polluted cities. And how have they come up with the fact that, why have they come up with they being the most polluted cities? And for that, I need to explain to you in terms a little about what exactly pollution is and how is it measured. So air
Right.
pollution is
Continue. Before you continue, I'm going to just say something. So, well, we are not going to be having a presentation by Dr. Banka, but she's going to be talking about it. Those of you who have questions, please, note them in your mind, and because it's important to pay attention to her, and you can ask these questions. Just do remember that this is not going to be, you will not be able to. We would advise that if you do have any issues concerning yourself or somebody else, clinical examination by a doctor is always very good. But as far as advice is concerned, you can ask that. So we may not be able to address all your queries, which are specifics, medicines, etc. That we will not be able to do. But please do ask your question in the Q&A tab, and or in the chat window. This is a new format that we're doing, and we will then address this question to Dr. Banka later. Over to you, doctor.
Yeah, so let's start off with actually understanding what air pollution is. So air pollution is basically a combination of two things. So one, you have gases which are released into the atmosphere, and the other is particulate matter. So you might have heard something like PM. So particulate matter is the other part. So coming to the first part of pollution, which is the gases. So uh, there are gases which are released into the environment, such as carbon monoxide, nitrogen dioxide, sulfur dioxide, ozone, and these are the harmful gases that are released. Now, how are these gases released into the atmosphere? So, most commonly, they are released because of combustion of vehicle of fuels, the combustion of industrial fuels, volcanic eruptions, forest fires. So, all of this combustion leads to release of all these gases, which lead to then harmful effects. Now we'll come to the harmful effects later. Now, the second part of air pollution is by something known as particulate matter. Now, what exactly is particulate matter? Now, particulate matter, so gases as we know is a gas, but particulate matter is basically a complex mixture which contains solid and liquid particles. And these particles are basically suspended in the air. So they're not visible to us in the naked eye, but they're just these small, very ultra fine particles which are just present in our air. Now, again, how do we get these particles in the air? Why are they there in our surrounding? Again, just uh, burning of power plants, residential wood burning that we have, forest fires, agricultural burning, construction, other combustion processes, motor vehicles. They all lead to the release of these particulate matter. Now, this particulate matter is again divided based on its size. So they have measured the size, which is micrometers, and they've divided that into coarse particles, fine particles, and ultrafine. So, of course, as the name says, the coarse ones are the ones which are bigger. So, just out of interest, so they have a particulate matter of 2.5 to 10 micrometers. The fine is something we call with a particulate matter of 0.1 to 2.5, and then the ultrafine nanosize is particulate matter of less than zero point 0.1. Now, what we know is that when these particulate matters are present in the air, so of course, air pollution primarily affects the lungs. Of course, it affects a lot of other organ bodies, but it affects the lungs primarily. And why does that happen? Because we all inhale and exhale air for normal living. And when we inhale air, we don't have a filter in terms of the air that is going in. So whatever is the air composition in the ambient air that you're breathing is going to go in. So imagine if your air has all these gases like carbon monoxide, sulfur dioxide, nitrogen dioxide, ozone, and it's got all these fine particles that are present in the air. When you inhale them, these particles are of course going to go inside your body as well. So when you inhale them, so the big particles, so when we spoke about the coarse particles, they tend to stick in the bigger breathing tubes, whereas the fine particles, they go up into the smaller breathing tubes. And the ultra fine particles, they can even go beyond the lung and they get dispersed into the blood circulation. So when that happens, it produces all the other systemic side effects of air pollution. So this is the way actually air pollution leads to detrimental effects on the respiratory system. Now, how do we measure this, how polluted our environment is, or how good or bad the air is? And for that, we have something known as the air quality index. So, what the air quality index is basically, or the AQI, which all of us have heard, it is basically a composition which measures five factors. So, it measures the level of particulate matter which is in the air, it measures the level of ozone, it measures the level of few of these other gases, and based on that, we have a grading which tells us that the grading that starts from 0 and it goes up to 500. And the lesser the number is, meaning the more cleaner the air is. So in general, so WHO recommends that good healthy breathing air should have a AQI or a air quality index of less than 50. Now, when I say less than 50, it means that the particulate matter, the gas composition of the air that you're breathing is very low. And that is what is generally what we need. 50 to 100 is considered to be ambient, meaning that, that is still okay to have that kind of an air. And anything above 150, 200 is considered to be not, not ambient. And anything above 300 is in fact considered to be hazardous for our breathing. Now, again, there's enough data to show that lower socioeconomic status countries have worse air pollution, and that's of course because of increased construction, increased fossil fuel burning, increased forest fires, so on and so forth. And not surprisingly, again, there are 8 million deaths that happen because of air pollution every year globally. Of these, 4.2, nearly half of these are because of air pollution, which is ambient air pollution, and outdoor air pollution, whereas remaining half are because of indoor air pollution. And of these 4.2 million, because of outdoor air pollution, India contributes to nearly 1 million of these deaths. So nearly 30% of, around 25 to 30% of deaths due to outdoor air pollution globally happen because of India. And the second, and the leading country of air pollution deaths is actually China. Now, uh, now moving on to moving on to the air quality index. So we all heard about the AQI, especially it was all in the news uh, in the latter part of last year and the early part of this year, where we saw the AQI being as high as even 400 for a few days in Bombay. And in fact, majority of the days in Delhi, the AQI is assumed to be more than 180 to 200, which automatically means that the air that we are breathing in is quite unhealthy. Now, we all talk about, not smoking because it leads to uh, increased lung damage. It makes your lungs weaker. But but when you have a AQI of say more than 200, it's basically equivalent of the amount of smoke that is generated by 7 cigarettes. So despite you not being a smoker, but the fact that you are living in a city which has a AQI of say more than 150 to 200 automatically means that you are smoking 7 cigarettes a day. And to make matters worse, or to make matters even more scary, is that babies who are in the womb, or pregnant ladies, or even toddlers or infants who are born, or toddlers, they are also having smoking 7 cigarettes a day, not in literal sense, but just the air that they are breathing is so polluted that they are literally smoking 7 cigarettes a day. So just based by this logic, so when you are breathing such an unhealthy air, you are going to, of course, have the detrimental effects of these. And what are the detrimental effects that we know? So let's start off with the most basic one. So when you are exposed to this kind of an unhealthy air, the first thing that leads to is restriction in growth. So your lungs do not expand, your lungs do not grow up to the same levels that your Western counterparts would have. And one of the biggest factor of that is the air that we are breathing is so polluted. So that leads to a reduction in your lung capacity. And in general, in life, physiologically, as we grow older, our lung capacity decreases. So when we are starting off with smaller lungs, when we are starting off with a smaller lung capacity because of the poor air quality, it just tends to multiply, or it just tends to get worse as we grow older, compounded by the fact that anyway our lung function is going to decrease. Now, we all of you all might have heard of this term called COPD, or chronic obstructive pulmonary disease. Now, as the name suggests, it's a chronic respiratory disease where after a point your breathing tubes get very narrowed, and all the sacs in your breathing tubes, they eventually become very distended. And the most common cause of COPD worldwide is smoking. So either smoking cigarettes, or in our country, bidi. Now, cigarette smoking is not the most common cause of COPD in our country, and we are the third most leading country with COPD cases across the world. Why is that? So, if I'm saying that smoking is not the leading cause of COPD in our country, the leading cause of COPD in our country is pollution. Now, that could be either indoor air pollution because of burning of chulha or burning of coal, that is very commonly used in the rural sector, and also because of the pollution in the air, the ambient air pollution, which leads to which can lead to development of COPD. Not only that, it also leads to worsening of symptoms of COPD. So, as Mr. Pradyuman, very correctly asked me that did we see a number rise in the cases, and absolutely we did. So, the times when the air quality index worsens in the city, that is directly proportional to the number of patients who get admitted with respiratory symptoms, or the number of patients who present to the respiratory OPD with worsening of their asthma or worsening of their COPD symptoms. Um, the next thing that we also know, what other impacts can the air pollution have on the respiratory system per se, is lung cancer. Now, earlier, nobody, again, lung cancer was always thought to happen because of in smokers. But in India, again, maximum lung cancer is found in non-smokers and in females. Now, why is that so? So, a lot of now the WHO has labeled these particulate matter. So, we spoke about the particulate matter, which is released by combustion of fuels, and the particulate matter has been labeled as a carcinogenic meaning any substance which leads to the formation, which leads to the development of cancer. So they have found that particulate matter is carcinogenic, in the sense that it leads to the development of lung cancer. So what exactly happens in, um, you know, because of the effects of this particulate matter in lung cancer? So when we inhale this air which has a lot of particulate matter, the ultrafine particles, which are the smallest particles, they get absorbed into our blood. So they move from our lungs into our blood vessels. Okay. And once they move into the blood vessels, they cause a lot of inflammation in the cells of our body. And that inflammation leads to something known as oxidative stress. So it leads to a lot of stress in the body. And this stress is responsible for converting the normal cells of our body to tumor cells. And this tumor cells then eventually lead evidence to show that lung cancer is strongly related with moving out of respiratory, that lung cancer can also sorry that can also lead to cardiovascular effects. So air pollution has been associated with increase in heart failure and increased risk of strokes as well. We also PD worsening of development of lung cancer, and it can also cause recurrent lower and upper respiratory infections. And that's because these particulate matters are come up with the particulate matter get also in the also in the air gets attached the the microbacillus, the fungi, the viruses. And when we inhale this, so in children, it is definitely associated with reduction in our lung capacity. There is a developmental delay. And now there are certain studies which have also shown that air pollution is associated with a shorter lifespan. Um, in pregnant women who are heavily exposed to air pollution has also led to the development of low birth weight baby bodies. Um, so in general, there is definitely increased risk of all respiratory infections, respiratory conditions because of air pollution. And it is, I think, a moral and societal responsibility to take care of air pollution in our own little way that we can on a day-to-day basis. Uh, because this is going to affect the generations to come, and it's going to have a very detrimental effect on health. So, thank you for listening to me, and very happy to take any questions.
Thank you very much, Dr. Banka, for this. We have a few questions that have come in that come to me by WhatsApp, and there's one which is there here as well. So this is from Mr. Anil Singh, and he's 60. And this is a question which I guess a lot of people uh, do have, given one of the gifts of COVID is that this is Mr. from Anil Singh. What type of masks should senior citizens use while going for a walk, marketplace, or a hospital? Should it be different or the same? And which one is a better reusable mask? Which one is better, reusable mask or use and throw types?
Sorry, Mr. Brown. So I think I missed some bits of it, but was it related to masks?
Yeah, so the question is, I'll repeat it.
Yeah.
This is from Mr. Anil Singh, who's 60. What type of masks should senior citizens use while going out for a walk to the marketplace or the hospital? Should it be different or the same? Which one is better, the reusable variety or the use and throw types?
So, really good question, Mr. Singh. So, the guidelines that came out during COVID. So if you are somebody who is vulnerable to get infections, or you're vulnerable, or you already have certain underlying respiratory diseases, so at least a minimum three-ply mask. So the normal surgical mask that we see should be worn. I don't think, and that's a one-time use and throw. So at the most, you can use it for a day and not more than that. Cloth masks don't do that well because they do not give you the entire protection. But the best mask would be a N95 mask. Now, a lot of people feel very claustrophobic with it and cannot walk with it. But if you do have, if you are extremely vulnerable to catch infections, or your underlying respiratory condition may worsen, then probably a N95 would be the best. But again, I do understand that it comes with its own limitations, that it's very claustrophobic, and a lot of people are feel very breathless walking with it.
In times like these, we have the pandemic is past us, but you have right now dengue and malaria and chikungunya and and the likes, which are kind of seasonal. So for things like these, are masks effective?
So not for malaria, dengue, no, for those masks are not effective. But let's not forget, this is also the season for flu. So after malaria, dengue, the maximum number of hospital admissions are because of influenza or flu. So, which is again a common born viral respiratory pathogen, can lead to severe pneumonias. So again, off the topic, but please get vaccinated for flu with your annual flu vaccine. And that would be the other reason why you would still want to continue wearing a mask even in this season.
And is this the right season for a vaccine, or is it
So
better to have it in the cold?
flu vaccine, you would generally take it pre-monsoons. So because that's when the new strain comes out every year for our part of the world. So we follow the southern hemisphere. So if you're living in USA or Europe or UK, you would get the flu vaccine typically pre-winter. So that would be in November, because that their flu season is the winters. But for us, the flu season is right now. So we typically give it pre-monsoon so that you develop the antibodies. But nonetheless, even if you've not taken it in May, there's no harm taking it right now. And then from next year onwards, you take it in May every year.
Doctor, this is an interesting question that I've received. I don't live in Mumbai or Delhi, but I often go to Delhi for work and to meet my relatives. What do I do whenever I go to Delhi? Because Bangalore has very good air quality, but not so in Delhi. Is there something I should do as a precaution, or is it something that one can't really do much about?
So I think all these effects that we've shown about worsening of respiratory symptoms and all that, this is or low birth weight or recurrent infections. So that's typically for people who live in these cities long term. So if you're just visiting Delhi for a short period of time, then I don't think you really need to bother too much, unless you're in a very industrial area, or there is where there is a lot of fumes and a lot of pollutions. In that case, you could wear a mask. But yes, I mean, if you do have an underlying respiratory symptom, you may notice worsening of those symptoms once you go to a slightly higher polluted city. So you might just want to go at a time when you're at the best of your health, and not go in when you've already got a bit of an infection, which can worsen in any of these cities.
Right. Doctor, there's one more question that has come in, which I've actually asked the person to send the question again. Yeah, here it is again. Uh, Doctor, what is the way in which one can check for the status of your lungs on a regular basis? I'm not able to shift out of Mumbai, but is it possible for me to check what the effect of the pollution is on my lungs on a regular basis? Will a chest X-ray do, or is there any other test that I should do?
So really good question. So more than chest X-ray, which is probably going to be normal, you can do a lung function. So that's known as a spirometry or a pulmonary function test, in which you literally blow into a machine, and that gives us what your lung capacity is objectively. So whether your lung capacity 60%, 70%, 80%, 90% of what it should be for your age, height, weight, gender, and all of that. So perhaps an annual, so once a year lung function may be the way to see um, what the capacity of your lungs are. But also, more with that, this is a very objective way of measuring it, but even subjectively you need to see. So if you are, say, if you notice that you are getting more breathless over the past, say, 1 year, what you could do a year back, and that's more difficult now, or you're getting recurrent infections, or you're getting recurrent symptoms with cough or wheezing, then of course you need to get evaluated earlier.
Right. Thank you. This is a question from someone whose perhaps name I'll hold back. The question is, in small cell lung cancer after doing chemotherapy and radiation therapy, why does lung cancer recur? Is lung cancer curable?
Uh, that's a discussion and a topic in itself. But just to give you crux, so small cell is the most aggressive type of lung cancer. So if we just assume that lung cancer can be type A, B, C, D, and small cell is A, if it's supposed to be A, it's the most aggressive out of A, B, C, D. Now, why does lung cancer is lung cancer curable? Yes, if you are in stage 1 or early stage 2. Now, what is stage 1, stage 2, stage 3, stage 4 is just the extent of the disease. And how do we know the extent of the disease is by a full body scan, a PET scan, and biopsies, which your doctor would recommend. So, if you are in your early stage where we can actually remove the tumor from your body, i.e., we just operate and remove the part of the tumor, you would be cancer free. Uh, but if the tumor has spread to other parts of your body, we can't remove every part of the body, right? So we can't remove your lung, and if we can't remove your liver if it's spread to the liver, or we can't remove the bones if it's spread to the bones. So in that sense, even though we might be able to control it with medicines, we haven't got rid of every single cancer cell from the body. And once we stop treatment or we don't give treatment, the cancer cells again divide and can cause a relapse. I hope that I answers the questions briefly.
Yeah, yeah, yeah. Thank you. We have another question from Mr. Anil Singh. He asks, the person has had TB in the past and he has taken a full course and recovered. Is he more vulnerable for lung diseases and cancer due to AQI or pollution?
That's a really good question. So again, TB of the lungs is quite common. It's a most common infectious disease that we see. Now, when TB heals, it depends on how TB has healed. So if somebody started off with a really small patch in the lungs, the TB will heal completely, and you would be left with like no scarring or any sequelae of TB. So in that sense, you're left with very healthy lungs even at the end of your treatment. Now, if you've started off with TB, which has extensively affected your lungs, meaning it's already led to the formation of a lot of cavities and it's already destroyed quite a bit of your lungs, even though you get rid of the TB, your lungs is still left with a bit of scarring, your lungs is still left with a bit of sequelae, and this is eventually going to lead to a lower lung function than what you would be without TB. Now, so in that sense, so there is no association of TB lung being associated with cancer. So it's not like if you had TB in the past, you are at risk of getting lung cancer. But if you had TB in the past and if your lungs have gotten a bit weaker because of that, yes, the air pollution can make you more prone to get recurrent infections or make you prone to get um, recurrent infection, not in the sense of recurrent TB, but recurrent viral infections or recurrent bacterial infections, you would be more prone for that. You could be more prone for that.
Uh, there is another question that has come in, which is, uh, Doctor, I have been a smoker for a good part of my life, but I've given it up. I live in Delhi, and do you think the the chances of my getting a lung disease is very high, because even though I have quit smoking, I live in Delhi where there's a lot of pollution.
So, first of all, well done for for quitting smoking. That's an achievement in itself. So, congratulations. Now, I mean, it would all depend a lot in terms of how long you've smoked and how many did you smoke a day, so on and so forth. But the crux is that if you've left smoking, that is the best treatment to prevent any lung diseases. So if you have no symptoms, I would not really bother with it. And if you are, say, above the age of 40, you would might as well want to do a annual health check and also get your lung functions checked at that point. And if they are low, then you would want to meet a physician. But I would otherwise not recommend. I mean, if you've quit smoking, that's great. But apart from that, just a good, healthy lifestyle is what you need at the moment.
Right. Thank you. There's another question that has come in, is that my relative has had COPD, uh, and has suffered a fair bit because of that. Is there any permanent cure for something like the COPD?
So of course, stopping smoking. And if you are really debilitated with COPD, depending on how poor your lung functions are, um, how old you are, and all of that, lung transplant is could be an option.
Right. I want to ask you this question about, this is oft not asked by anybody, but we you are in Mumbai. There are so many people who are in Delhi, and all of that. Now, are medical professionals exerting some pressure on the governments and administration to do something about the pollution levels that are there?
That's a really good question, Mr. Pradyuman. So, I think there are certain committees. So, so we do have a national respiratory the Indian Chest Society or the National Respiratory Society, and that has written to the government a couple of times, especially when the air quality had deteriorated very significantly in Mumbai and Delhi. And I knew for a few days people were given an off in Delhi because the air quality was so bad. So there have been a lot of pleas uh, in terms of writing to the government to take some steps towards uh, controlling air pollution, because eventually, of course, every individual needs to act, but till the time the government does not set up policies or have regulations, air pollution cannot be controlled. And that's the same thing that happened in China. It was only when the regulatory authorities got more strict have the air pollution levels come down there. So as much as we plead and as much as we try to create some mandates, which we have in our own capacity, till the time the government regulatory authorities do not consider this as a serious problem or a menace, I don't think things are going to move ahead.
you know, uh, this is not the time to say this, but I think sometimes shock and awe helps. So if I must one were to do a study with, say, rickshaw drivers in cities like Mumbai and Delhi, or just the handcart guys who are on the road in these two cities, I'm sure it will throw some really shocking results. We have a chief minister in Mumbai, in Maharashtra, who was a rickshaw driver once upon not many, perhaps many moons ago. But the point is that it unless and until that is there, because here it is, we are a group of senior citizens here. There are, 89, 90 people gathered here to hear us. And I think somewhere we need to exert ourselves on the path that we to ensure that is there. But the next question that I'm going to ask is something that we have under control. This is for smoking. It is said that passive smoking is more dangerous than active smoking. Is it true? And my supplementary to is that what do you do when you are subjected to passive smoking? Of course, the fact is that in this day and time, most workplaces have become smoke free, and there are rules and regulations from government also that certain
Yeah.
areas are smoke free. But what should one do if one has no option but to take inhale some smoke passively?
Yeah. So coming to the first part, whether passive smoking is worse than active smoking, no. I'm not saying passive smoking is not harmful at all, but definitely not as harmful as active smoking. And definitely not more harmful than active smoking. I think passive smoking, one good thing that the government has done is it made it really difficult to smoke in public places, just because of the strict regulatory authorities. I don't think you have an option apart from just moving away, or not being in the company where there is smoke. But yeah, if you are sharing the same household with somebody who's smoking, and if it's that kind of a thing, at least you would want to keep the windows open. At least you would want some amount of cross ventilation when smoking is happening in the house, so that at least the smoke that is released is just doesn't circulate in the air, and it does move out because of air circulatory changes. But yeah, I don't think there's a solution in terms of what you can do apart from just being away as much as you can, and just being in a or just at least being in an open space, so that there is some change of air.
And seniors over here, you must ensure, use your age and your influence to ensure that your households are smoke free, and you ensure that children, your grandchildren, breathe good air at least in the homes. I think that's the least that we can do. Uh,
Absolutely. Absolutely.
Thank you very much, Dr. Banka, for being here, and to all of you here. I know we have a large number of people. We have a slightly different interface that we have developed. So perhaps some of you are grappling with how to ask questions, but we have still got a fair number of questions today. Uh, Thank you once again, Dr. Banka, for being here. Thanks to the team at the Hinduja Hospital and AdFactors for facilitating this. And we hope to have you again, not after a year, perhaps sooner, and on another question and another concern that afflicts us all. Uh, Once again, we will be back next Saturday at 5 p.m. as which is our regular hour for the health webinar. We will, but this is on Saturdays. On other days, you know that the Evergreen Club, which is now part of the Seniors Today family, has a host of events morning and evening. You can attend them. Download the Evergreen Club app. There is the magazine, of course, which has completed 5 years. So fifth anniversary issue is there, and it is free of cost. There is all the content that is available on the website, which you can subscribe to. Some of these links are there on the chat window, so you can do that, and pre-register for the health webinar in case you don't want to miss out on any of our notices. So we will be there once again next Saturday. Thank you very much once again, Dr. Radhika Banka, for being here.
Thank you.
Thank you.
Thank you, Mr. Pradyuman, and
Yeah,
have a good evening, good weekend ahead.
all of
Thank
you.